NHS Test and Trace means we can start to replace the national lockdown with individual isolation for those who've been in contact with the virus and local action where it's necessary to respond to a flare-up. The concept is simple. First, through testing, we hunt down the virus, finding out who is infected right now. And I use we very deliberately because we all have our part to play. This is a national effort and we all have a role. If you have symptoms, you must isolate immediately and get yourself a test. Yesterday, 2013 people tested positive, and the next step is that through contact tracing, like detectives, the NHS clinician from NHS Test and Trace and the person who's tested positive work together to identify the possible movements of the virus, where it's been, and who else it might have infected. Then we isolate those contacts who might have been infected so the virus is unable to spread and we break the chain of transmission. Think of it like this. The virus exists only to reproduce. That is its sole biological purpose, to make as many copies of itself as possible. If we can thwart that purpose, we can control the virus and ultimately defeat it. We must all follow the NHS Test and Trace instructions because this is how we control the virus and protect the NHS and save lives. Some people have asked, why now? Why not launch this programme earlier in the course of the pandemic? The answer is because we needed to flatten the curve. Right at the start of the epidemic, we had a contact tracing system in place, but as the virus raged towards its peak, the number of infections grew so large that we needed a national lockdown. That was the only way to get it under control. Effectively, everyone in the country was contacted and told to stay at home. Now, we've got the number of new infections each day right down, and the number of contacts of those who've tested positive is small enough that we can be in touch with everyone who we need to. And of course, testing capacity is critical to making this work. We now have the capacity for 161,000 tests a day. And because of that increased capacity, I can announce that we're expanding eligibility yet further. From tomorrow, we're expanding eligibility for testing to include the under 5s, so that now every single person who has symptoms of coronavirus can get a test, no matter their age. And what's more, to make NHS Test and Trace as effective as possible, it is very important that everyone with symptoms must isolate immediately and go and get a test. Now, I want to thank and pay tribute to everyone who's been involved in making this big project happen. Dido Harding, who's led the work, the technicians in the labs who've been making mass testing a reality, the contact tracers manning the phones, the healthcare staff providing the expert advice, and the companies who've helped us put it all together at a record scale and pace. And what really matters is this: to protect your friends and your family, testing and tracing must become a new way of life. This is being launched today in England. Northern Ireland already has a system in place, and my colleagues in the Scottish and Welsh governments are working to bring in a system as soon as they can. All 4 nations have been working together to make sure we have systems that are coordinated across the whole country. And the instructions to people are clear. If you get symptoms, isolate immediately and get a test. If you are contacted by NHS Test and Trace instructing you to isolate, you must. It is your civic duty. So you avoid unknowingly spreading the virus and you help to break the chain of transmission.